I'm Dr. Jafari with Integrated Family Dentistry. If you're watching this, you or your child recently had a procedure, and I want to guide you through the healing process. I'll be covering what to expect over the next few days and how to care for the surgical site to promote a smooth recovery. Let's get started. Wound care and bleeding. It's normal to experience some light bleeding or oozing in the first 2 to 3 days. However, if you notice a steady or heavy bleeding, place gauze under the tongue to apply gentle pressure and contact me immediately. If needed, visit your local emergency department. Swelling and inflammation. Some swelling and discomfort are expected in the first 3 to 5 days. Your tongue may feel larger than usual and more difficult to move. To help manage this, I recommend alternating Tylenol and ibuprofen every 3 hours on the first day and then as needed afterwards. You can also apply Stella Life Gel 3 to 5 times a day to reduce inflammation and promote healing. We will take note of your first dose of medication and time so you can reference back for your following doses. Ice therapy. To help manage swelling and discomfort, apply a cold compress or ice pack to your neck and jaw area for 10 to 20 minutes every 2 hours while you're awake on the first day after surgery. You can continue this as needed throughout your recovery to keep swelling under control. Sutures. In most cases, we use absorbable sutures that will naturally dissolve within 3 to 5 days, though some may last a little longer. As they dissolve, granulation tissue will form, which is a part of natural healing process. Periacral glue. In some cases, we apply periacral glue instead of or in addition to sutures. This glue can feel rough as it hardens, but it's important not to pick at it. If it remains after 1 week, gently massage the area with vitamin E or coconut oil to help dissolve it. Wound healing and Serrapeptase application. It's important to note that tongue mobility may initially decrease between 1 to 3 weeks after surgery, but typically improves over the next 2 to 6 months. Wound contraction begins around day 5 to 10 and can last up to 2 months as part of the normal healing process. To support healing, we recommend starting Serrapeptase around 4 to 5 days post-op, or once all sutures have dissolved and granulation tissue has formed. If you notice any bleeding, discontinue use immediately. Serrapeptase application instructions. When applying Serrapeptase, be sure to use Serratia brand. Lightly coat the wound site under the tongue, then place a piece of gauze over the area and wait 3 minutes before beginning your wound care exercises. This should be done 2 to 5 times daily. Be careful to avoid eye contact and be sure to wipe away any excess drool. Oral hygiene. Keeping your mouth clean is essential during healing. You should continue brushing as usual, but be gentle around the sensitive areas. Rinsing with a mild saltwater solution may also help keep the area clean. Food and drink. For the first few days, soft and cool foods are best. Avoid anything hot, spicy, or difficult to chew, as these can cause discomfort. Staying hydrated is important, but try to avoid drinking through a straw to prevent unnecessary pressure on the healing site. Myofunctional therapy exercises. For the first 3 days, focus on gentle, natural tongue movements, like speaking, singing, or reading out loud. Avoid strong suction, sticking your tongue out forcefully, or strenuous tongue exercises, as these could disrupt the sutures. Be sure to follow up with your myofunctional therapist within 5 to 7 days after the procedure for personalized guidance on stretches and exercises. Wound stretches. Starting 72 hours after surgery, we recommend key stretches like the J-sweep, forklift, and tongue pull stretch. These should be done under the guidance of a trained therapist to ensure proper technique. Overstretching or incorrect movements can cause injury, so always follow your therapist's recommendation. Lip and buccal ties. Beginning on day 2 or 3, we suggest using air puffs and gentle rinsing. You can also place a clean finger at the incision site and apply light pressure for 20 to 30 seconds, 2 to 4 times a day to aid healing. Additional therapies. Many patients benefit from body work such as craniosacral therapy, osteopathic manipulation, or fascial physical therapy to support healing. If recommended, these therapies can enhance mobility and function after surgery. When to contact us? While mild discomfort and swelling are normal, please contact if you experience any of the following: severe pain that does not improve with medication, persistent or heavy bleeding, significant swelling at the surgical site, difficulty breathing, a fever over 102 degrees Fahrenheit. Our contact information is at the bottom of the page for any additional questions or concerns. In case of a true emergency, please call 911 or go to your nearest emergency department. Thank you for trusting us with your care. Following these guidelines will help to ensure the best possible recovery. If you have any questions, don't hesitate to reach out. We are here to support you every step of the way. Wishing you a smooth and speedy recovery.